I was in the same room, this huge room, as a junior parliamentarian pushing for the human rights of children. And today I'm also back in the same room talking about the human rights of people living with HIV, of young people and key populations. The increased use of artificial intelligence and digital systems in healthcare has improved access to services, but there is a lack of clear legal frameworks to protect human rights. This includes issues of accessibility, quality, and non-discrimination. So the main objective of this session is to sensitize civil society organizations and other stakeholders about the risks and opportunities of the digital transformation on human rights, especially for young people, for people living with HIV, and marginalized communities. So to help us unpack this topic, I'm going to be introducing our panelists. We have got the Executive Director of the award-winning KELIN Kenya, and he is a leader of a young generation of public interest lawyers shaping Kenya's democratic destiny. Everyone, can you help me appreciate Alan Maleche? Can we also kind of show him some love? Thank you so much. And we also have Maria Malo. She's on my far left. She's a senior international research manager with Restless Development. Can we also appreciate her? Thank you. And lastly, can you help me welcome Orlando Obodo, a program officer at KELIN and also an advocate with the High Court of Kenya. Can you also appreciate her? So I would like to leave this time to Alan to then also kind of give us an overview of the Digital Health and Rights Project. There is work that is being done, and I think this is also going to be shaping our discussion today. Over to you, Alan.
Thank you, Tinashe, and thank you to my fellow panelists, and thank you all for coming in for our session. I will briefly give an overview of the Digital Health and Rights Project. But before I get to that, we all know the importance of digital technology and how it has the possibility of helping us achieve the Sustainable Development Goals, particularly goal number 3 that deals with issues of health and well-being. But the use of digital technologies is one that has not been very inclusive, especially for the case of young people, especially for vulnerable communities. So sometimes they're not involved in the design, in the rollout, and in the implementation of the use of the digital technologies that we employ in the delivery of health services. So it was on the basis of this that a number of partners came together from the community of people living with HIV through GNP+, from Stop AIDS in the UK, from KELIN in Kenya, Privacy International, the Uniandes University in Colombia, Restless Development, who were then able to think through how do we undertake research using a transnational participatory action approach. This is an approach that allows us to have young people at the forefront of designing the research, helping us disseminate the research findings and advocating together with duty bearers around what changes that need to be made. And so we are currently carrying out research in Kenya, Ghana, Colombia, and Vietnam to be able to understand how well are young people, particularly those who are living with HIV, engaged in the development of digital tools, engaged in the development of law policies and other frameworks that would govern the use of the digital tools. How do they handle issues of human rights violations when they happen in spaces where they are gathering information about sexual reproductive health, where they're gathering information about access to contraceptive, where they're connecting with future partners? How then do we ensure that those spaces are safe? We are also trying to understand what then is the responsibility of the private actors, what is the responsibility of governments when some of these things work and when they don't work. And so we have been able to mobilize young people to be part of the research. There's an advisory committee of young people that sits down together with the researchers, looks at the questionnaires, guides us, and gives oversight around how we're able to do the research. So this project is on its third phase. We have had previous studies in Bangladesh and elsewhere, and so we are hoping with this third phase that we are able to get stronger recommendations that will be able to use both at the global level, that mostly at the UN level, where WHO and others are developing products that guide the use of digital technology. We're also engaging with the African Commission and other people at the AU level around what then is the role of young people, human rights in terms of shaping the conversation that relates to issues of digital health. Previously, we have worked with the Special Rapporteur on the right to health, Dr. Taleng Mofoken, in her last report to the UN Assembly, to be able to point out what are the key human rights concerns for young people that governments, development partners should be taking into account when they roll out some of these particular technologies. So you'll hear more from my colleagues, but I just want to emphasize that in this particular project, we aim to provide leadership and educational opportunities to young people, and especially on matters of digital literacy, so that they are more empowered to take the mantle and to take the lead to be able to advocate for better tools, better use of technology in a way that enhances their chances of having access to sexually reproductive health. I'll turn it back to Tinashe, and happy to come back again for another round of sharing.
Thank you so much, Alan. So I would kindly ask if the tech people can help us with resolving the microphone challenge that we are having, so that it's more of a dialogue and a conversation that we are having. So Maria, I think Alan also kind of spoke about how we are aiming at engaging the community to be at the center of digital health and rights. So whether we are prepared or not, the world is moving, and young people, they are also kind of making digital technologies. So my question is also directed to you, Maria, in terms of young people's engagement. What has worked well, what is not working well, and what can we learn from the participatory research with communities? So you can also share with us those insights. Over to you, Maria.
Thanks, Tinashe. I don't know if people can hear me.
That's digital.
I think I'm now audible. Morning, everyone. You don't look so happy. Morning, everyone. Thank you. So one of the things that I always do, Tinashe, to respond to you, whenever I'm talking about young people and research, I always start with a little story. And I know you've heard it a dozen times, but I'm still going to repeat it. So at Restless Development, we conduct training on research with young people. And one of the questions I always ask before we start the training is, when we say researcher, what comes to your mind? And I think I'll also ask people here to just reflect on researcher. What does a researcher look like to you? I think you've thought about it now, right? So young people often say, whenever we think of a researcher, we think of an old white man with a PhD who wears spectacles like Einstein, with probably crazy hair like Einstein as well, and sitting in front of books. And one of the things that we then talk about is how research is often viewed from a very patriarchal way, very colonial way, racist way, issues around age come into play, and yet every day young people are conducting research. They research on who they want to date, they research on which schools they want to go to. So the reason why I'm talking about this, it's because it's important for us to understand that research is not the privy of a select few. All of us conduct it at some point. They might not be able to use these complex words like epistemology, but they really know what they want to talk about. And we've done this at Restless with young people from rural communities as well. So the basis of everything is understanding how, as we are engaging young people in the participatory research, we need to constantly think about shifting power, making sure that we identify the power dynamics within the room, and ensuring that we give the young people the power that they deserve, right? Because often I find a lot of tokenism when it comes to youth programming, where everybody says, oh, we are engaging young people, and yet when you look at it, at the core of it, there is no engagement. And for the Digital Health and Rights Program, we actually do engage young people. Alan mentioned about the advisory committee of young people, which actually defines the questions that we will be asking in the communities. So we don't just say to them, rubber stamp what we have, but we say, contribute to what we have. And this is based on the thinking that whoever defines the research questions, whoever defines the data collection methods, also defines the analysis of that data, and ultimately defines how that data is used. So if we want our programming to be focused on young people, if we want advocacy to actually make sense for young people, we need to make sure that they're engaged and they play a critical role right at the beginning of the project itself. And we involve them in research. We also provide training, digital empowerment training. And the manual did not come from me or from Tika or from Tinashe or from KELIN. It actually came from the young people themselves. We involved them in defining the manual, because what's the whole point of having young people in the room and teaching them about digital empowerment, and yet they are not involved in defining what they want to learn? So that's the foundation of what we are doing. And I hope that everyone in the room can learn how to engage young people from us. Thanks, Tinashe.
Thank you so much, Maria. So I think just as a follow-up question to that, because I understand that from the Digital Health and Rights Project, it's more of exploring the future of human rights in the digital age through research, digital literacy, and also advocacy. How are you also engaging young people in advocacy for the digital health and rights?
Thank you. So the first thing that we are doing in terms of engaging them in advocacy is having them be part of the process, the research process. And for us, that's also fundamental. But the second thing that we are also doing is ensuring that they are in spaces where they are able to influence policy at the national level and also at the international level. So what we have done is we've provided leadership training to young people so they understand what is it like to be a leader. How can you talk? Because at times it's really scary to be talking to these president of a country or very influential people. So young people need to understand what leadership is all about. They're undergoing leadership training and also mentorship, because each of them has an objective. What we've also done this time is to have a leadership diary for them, where they sort of trace their leadership journey, but at the same time, they also give feedback on how they feel the spaces are working or not working for them. And it's very important because often we say there's ICASA and we have all these young people coming to ICASA. There's Women Deliver. We have all these young people going to Women Deliver. But as we analyze the impact that has on, one, their leadership, but also two, the issues that matter most to them, we sometimes realize that we do not have much impact, right? So we need to be able to trace that leadership journey and to also trace the advocacy spaces. Are they working for young people? If they are not working, how do we ensure that young people are at the forefront of demanding certain changes so that those spaces work for them? Thanks, Nash.
Great. Thank you so much for that, Maria. I'll come to you, Orlando. How has the Digital Health and Rights Project been? Okay. Thank you so much for being patient with me. How has the Digital Health and Rights Project been working in Kenya, and what has been your experience?
Thank you so much, Tinashe, for that lovely question. Hello, everybody. Good to see you. As my colleagues before me have mentioned, the Digital Health Rights Project is based in 4 countries. That is Kenya, Ghana, Vietnam, and Colombia. And I implement in Kenya. And Kenya's main focus is similar to the others. However, we at the national level are focusing on key affected populations and persons living with HIV. So our research areas are going to be focused on 4 areas within the country, being the central, the coastal, and the western side. Counties are like regions, the way we have Harare and Bulawayo and where else? And somewhere else. So like that. And we're currently really focusing on the research bit of the project, and we have actually just finalized the research protocol, which has been forwarded for ethical approval. And before then, we were able to get input from the Kenya Community Advisory Team members. So we, in September, were able to recruit 12 young people between the ages of 18 to 34 who are part of this project. And just as Maria has mentioned, we're not here to rubber stamp on the work that has already been done by the larger consortium, but these young people, I as a young person, I'm actively involved in this project, and we are making recommendations and comments and reviewing documents that will be steering this research forward. And we've already gone through the research protocol, we have gone through the FGD guidelines and the KIIs, which I have mentioned have already been submitted. So hopefully we'll continue the work in January 2024 once the approval has already been done. As a matter of fact, one of our key Kenya advisory team members is here. Please, Jerome, just wave to the crowd. That's one of the young people that we work with in Kenya, and we're very honored to have her and 11 others contribute immensely to this project. I would also like to talk about, as a young advocate, it truly is an honor, as I have mentioned, working alongside other young people and the larger consortium based in various countries on this research project. And our focuses are going to be on the laws and policies around digital health rights in Kenya. We're also going to look at the digital ethnography. We're also going to really focus on young people from the various counties through the FGDs and KIIs. We're also going to do a lot of data collection and data management. And eventually we're going to disseminate the same report once it's ready, probably in the year 2025 within the region. And it would be prudent of me to not talk about the Digital Health Act of Kenya, which has recently just been enacted, which I think is a lovely step towards the right direction in terms of what digital health rights and regulation looks like within the country. And I think it's important for us to not just have these conversations, but also have regulation and policies and many members of, I'd say, stakeholders who need to be involved in ensuring that not only the policies are in place and they exist, but what are we doing about them? So I think it's a very exciting time for us as the DHRP, and especially even at the national level. I can't wait to see what this project will look like eventually for, once we're done with the research bit. And I think it's an exciting time. Thank you, T.
Can we clap hands for Orlando? Thank you so much. So I am now coming back to you, Alan. How is the consortium being managed? Because there are many organizations that are also bringing more of a value add to this consortium. And I'm just curious to also kind of really understand how is the consortium being managed, and how has this also kind of impacted the work that is being done in the region? If you can share with us some of the benefits or challenges so that our delegates, they can also learn from these projects, that would be great.
So thank you, Tinashe. Before I move to the question, I just want to emphasize that there are 3 important things we try to address in this particular work that we're doing and this particular consortium. And I think the first one is a meaningful participation in digital governance for young people, that where there are governance frameworks that involve conversations around digital technology, we are trying to ensure that we prepare, we support, and ensure that young people get into those spaces and communicate their views, their findings, and their thoughts. So that's an important step for us. And then secondly, there's a concern around digital empowerment. How do young persons understand what does it mean to use a certain technology? What are the do's and don'ts? If a violation happens, say your privacy is breached, if your information is spread around recklessly, if there's breach of data, especially if you're a criminalized group, because we also work with sex workers, men who have sex with men, we work with drug users, we work with people living with HIV, and in certain countries, people living with HIV are criminalized, and so sometimes it's sensitive to use their data. So the digital empowerment is an important aspect. And then lastly, just to emphasize the fact that you're trying to address the issue of digital divide. As much as everyone is saying use technology, there are people who may not have access to phones. There are people who may have access to phones but no access to data. So again, there are still conversations with governments to see how well do you make the digital divide become less and ensure everyone has access to these aspects. Now, in terms of the question of how we work in the consortium, it's an interesting setup that has two academic institutions. The one hosting us is Warwick University in London. We also have a university from Colombia, Uniandis, and then we've got civil society organizations being KELIN, Privacy International, Restless, and then we've got the network of people living with HIV GNP+, that also has its members from Ghana and Vietnam who are part of that conversation. And so living up to a participatory approach, we all work towards ensuring all voices are heard. We work towards ensuring that there's equal representation of the organizations in decision making, but respecting the different cultural settings from those in Colombia, from those in Vietnam, from those in Nairobi, and from those in Accra. Most importantly, we have tried to come through with a governance system that allows young people to be able to take leadership in leading some of our subcommittees, some of our works like the community advisory groups, and that is giving them a chance to grow into leadership roles and to be able to take us into the process. There are challenges for this. Bringing people from Colombia, Vietnam, Ghana, Nairobi, the UK, and elsewhere together frequently is not cheap, and the project does not have lots of money to be able to facilitate that, so we have to think through how well do we communicate, how well do we interact. We are also keen in addressing the digital divide to have our research done in an urban area, in a peri-urban area, and in also a rural area. But again, we are limited to what extent we can reach in terms of many stakeholders with this. So those are some of the limitations we face, but hopefully we feel that with the number of people we're going to work with, there will be some sufficient information to come up with recommendations that would guide the UN partners, governments, development partners, and even our colleagues in civil society around how do you safeguard the rights of young people when it comes to them embracing the use of digital technology, particularly when they are trying to access healthcare services. Thank you.
Great. Thank you so much for that, Alan. So I would like to also come back to you, Maria, and I'm sorry to put you on the spot, but I think one of the things that were also mentioned by Alan as a challenge was looking at issues around digital divide. I just wanted to find out in terms of some of the findings from the research that was conducted in line with maybe with young people. Were there any issues around security and privacy that also kind of emanated from that research, particularly looking at young people living with HIV, people living with HIV, and also communities of key populations?
Thanks, Tinashe. So one of the biggest challenges, like Alan pointed out, are the issues around safety and security, and that was really brought out. Safety and security plays a key role in whether or not young people access digital technologies, and even more when they're talking of digital health, because you find young people who are part of the key populations, they complain about how sometimes their HIV status is shown to everyone. Basically, they don't understand how that data is used, but as well how personal data, which is collected at hospitals and institutions, is also used, right, by both government and the private sector. So that's a really big problem. And it's something that we've really been talking about and contemplating about. How do we ensure that the young people using these digital spaces that we are promoting are actually safe enough to use those technologies? And how do we work even with big tech companies to ensure that they safeguard the health and the well-being of young people. So yes, it came out, and it's a very serious issue. And as we move into this next stage of the project, one of the things that we are talking about is around safeguarding. And how do we, because it's quite difficult working with young people, because beyond just the issues of their safety online, there are also issues about when we collect data from them, are they protected from any form of harassment, whether be it from the communities where they come from or from us as the adults in the room, right? So we've really got strict safeguarding policies and principles that we adhere to, and we ensure that as we are working, we think about the digital divide, and we work remembering that we need to work in a way that does not oppress young people. So anti-oppression is a big part of this work. So as you engage young people, how do we ensure that there is no oppression, and how do we ensure that we are decolonizing the digital space? Because often if you listen to AI, you're listening to this person with probably an American or British accent, and you will probably not find anyone with an accent like mine, which is Zimbabwean, right? But how do we decolonize these spaces and make sure that they work for young people in all their diversity, even for those who are in rural areas? Thank you.
Thank you so much for that, Maria. So this is more of a last question, which I'd like us to then also reflect on. So Maria spoke about it before in terms of decolonization, and I just wanted to find out on some of the key considerations for working in such a consortium that is also coordinated by the Global North organizations, but also the main focus is in more of the Global South countries. So maybe I can start with you, Alan Ndugu.
Tinashe, that's quite a difficult question in the circumstances that the world is now, but it's important to realize when we speak about decolonization, we are talking about challenging situations and spaces where certain groups of people have enjoyed power and privilege to the exclusion of other people. And so in that context, particularly for our project, we are quite aware of the fact that we want to work in a space where all partners are treated equally, where we have minimum standards that we agree that irrespective of who signed the grant, whoever is the lead implementer, all partners are equal and we all have equal deliverables, and also have a steering committee where everyone has one vote and we are all able to decide aspects from a democratic perspective. So on the side of governance and leading the consortium, we have crafted carefully ways to ensure that no partner is more dominant than another. And where that happens, we are working on ways to ensure that there are systems for redress to flag that out and to ensure that it doesn't happen again, so that we can ensure there's equilibrium from the researcher in London to the researcher in Kenya, to the researcher in Vietnam, and to the researcher in Bogota. And so that's one way we do it. But in terms of the actual participants who are involved in our advisory team, we allow them to be able to make their own rules, regulations, and decision-making processes, and only guide where necessary and respect the guidance that they give. And also in terms of ensuring that young people from different parts of the world get into the governance spaces, we invest a lot in terms of preparing them, in terms of making them sure that they have the support they need, whether it's visas, whether it's booking the hotel. It may sound like something so small, but sometimes it's quite mundane for people who may not have had this exposure. So we struggle a lot to ensure that they have a lot of exposure in some of these spaces, but we do so in a way that allows them to be able to participate. Lastly, we try to ensure that a majority of our resources are being focused on the actual work, which is the research, the dissemination of the research findings, and the advocacy. So a larger part of our budgets are more focused on the real action and the real research that will help get funding and findings that will help us advocate more for young people to bridge the digital divide, to be more digitally empowered, and to be more meaningfully engaged in governance processes that involve digital technology. Over to you.
Fantastic. Thank you so much for that. So Maria and Orlando, I'm going to give you 60 seconds each maximum, so that we can also hear from the delegates if they've got any questions to the panel.
Thank you. I think Alan has really emphasized on the mechanisms we have in place to be able to regulate in terms of working within a huge group of people coming from diverse backgrounds and diverse countries, and the aspect of decolonization. I would only like to make emphasis on the K cut in terms of the young people have the liberty and the freedom to be able to interact with us at a professional level, where we're really trying to ethically engage with them. And I, as a young person, I'm really at the forefront of this and ensuring that nobody feels oppressed within the system. And we also have mechanisms within the research, within the consortium, such as anti-oppression mechanisms to be able to deal with any of those, I'd say, issues that may arise.
Thanks, Tinashe. So I think everything has been said. That's the beauty of speaking last, because everything has been said, basically. But I'm also going to say this as a feminist, that one of the biggest issues when we are talking about decolonization is also around feminization of spaces and ensuring that we adopt an intersectional approach in the work that we do. So we do understand the different dynamics that play when people are in one room, and the power structures and struggles that are there in that room. And what we endeavor to do as a consortium is to ensure that every voice is heard, regardless of whether you're going to be speaking in your mother tongue. If I speak in Shona, they'll hear me, although they probably would need a translator, and Tinashe can do that on my behalf. But the point is we endeavor to make sure that everyone feels part of the consortium and that we celebrate our diversity, because that's what makes this consortium rich anyway, right? And that's what makes our world rich, the fact that we are diverse. Thanks, Tinashe.
Thank you so much for that to my amazing panelists. I just want to find out from the room if there's anyone with questions or where you might need clarity. Okay, can I have a microphone to that end? Okay, thank you.
Oh, thank you. My name is Owen. I work with Searcher Zimbabwe, and I work with very young adolescents. I have over the past days been attending fora where talk is about adolescent girls and young women, adolescents, but hardly have had specific mention to very young adolescents whose realities are different from adolescents in general. May the panelists please touch a bit on that. Thank you.
Okay, so I'm looking at you, Maria. The reason being that I think there was a discussion in one of the meetings, mainly looking at the groups that are not represented and how the research is also going to be looking at the communities, those who are mainly in rural areas. So I thought maybe you could also kind of shed light on that.
Thanks, Tinashe. I saw you looking at me, so I knew. Hi, Owen. I've been in a space with Owen before. We've met before. They're doing a very beautiful project around positive masculinities. But to just answer that question, you know, working with, like I alluded to, working with adolescents and young people is quite difficult, especially as we start talking about issues around safeguarding. And we do understand the importance of working with very young adolescents, but we also understand the complexities of doing that. And much as it is an endeavor or something that we aspire to do, we still need to make sure that we have the systems in place to be able to work with these very young adolescents. When you talk about issues around ethical approvals, for example, they are often more difficult when you're going to work with very young adolescents, because the permission to talk to them actually comes from their parents, from their guardians, and it's quite complex. But also thinking of their own security as we work with them. So I think, yes, it's very important to work with them. And I do get the especially when you talk of digital rights, I've got a 12-year-old and she's already wanting to do TikTok and everything. So it really shows you how the generations that we have now are really awake to the importance of digital technologies, but as well exposed to the dangers that they bring with them. I'm hoping that the next time that we have this research, we actually include very young adolescents. And unfortunately, at this point for this project, we do not have very young adolescents represented.
Thank you so much for that. So Alan is saying no, because I have a question directed to him. So I think this can also be another question that maybe some of us in the room might have in terms of why are we talking about digital health and rights at this conference? Why are we connecting it to HIV?
I was hoping for more questions from the audience, Tinashe, but it seems like
there is another question.
Could we take that and then I can also add on to that? Okay.
Hi, everyone. So my name is Miriam Chipanda. I work for Lighthouse Trust in Malawi. So when it comes to digital health in Malawi, we've always focused on EMR, and then now we're going into ODK. But then now we're seeing different platforms also being used. For example, we've got social media, we've got WhatsApp, we've got Facebook, and then we're also going into issues of call centers and SMS platforms as well. So I just wanted to understand, when you're talking about digital health, which platforms are you focusing on? And considering that this is quite new to a lot of African countries, would really like to know and learn more about the best practices and also how to go about it in a cost-effective way. Thank you. Oh, and also taking note that other countries do have very limited access to internet as well as smartphones. Thank you.
Alan, over to you for the two questions.
Thanks, Miriam. And indeed, the platforms are quite varied and wide, but we have done previously 2 researches that have been able to figure out from the young people living with HIV. And to start off with Tinashe's question, many of the organizations that are part of this consortium have actively been involved in the HIV response. And so drawing from the activism and the involvement of young people and people living with HIV to actively advocate for their rights to privacy, even when there was no digital health, we are drawing from that experience from people living with HIV to see now with the infusion of digital technology, say biometrics, using of the iris, in the case of trying to avoid double counting for taking of pills, we want to be able to then make that linkage between what have we learned from the HIV movement in terms of advocacy for data, privacy, safety, and security in line with the use of digital technologies. So Miriam, in terms of the digital technologies we are looking at, we are more concerned around when you're doing the research to understand where are young people, especially either in urban or rural areas, getting the information about sexual reproductive health. Where are you getting information around where do I access a contraceptive, where do I access a family planning method? If I have a gyna issue, how am I able to access it? If I want to understand more around safe sex, which is the website I go to, is there an app that is existing? And from our initial study that we did in Kenya and Ghana, many people were either going to Dr. Google, a few had apps, a few had signed up onto menstrual apps. So it varied in terms of what access and what exposure did you have. And there are some who attended medical facilities that would actually collate their data and keep them within a database. So we don't look at specific digital technologies, but we are guided with what we find around the research. And from what we then find, we then question, if Dr. Google gives misleading information, who then are we going to hold accountable? And what is the government in Ghana doing to hold Google accountable in case there's misinformation around, say, safe abortion or family planning methods? Because many people are going there. Or if you can look at it from the reverse way, how do you work with the people at Google or any other platform that has got the responsibility of generating messages that is not misinforming people? So how do we hold them account to understand the standards they put into place, the safeguards they put in place, especially when you're dealing with information for young people, be it TikTok, what kind of safeguards are they actively putting themselves before they get to be held accountable by the government? So based on what we find in the research, It guides us on how to engage with the different platforms and the different players. But generally then our research is then used to tell either WHO or UNDP to say, look, these are the issues that are coming out. What guidance would you be able to give to governments, either at a global level, either at a national level, either at a regional level, that will help them think through how to safeguard those who are accessing the platforms, because at the end of the day, they will continue accessing those platforms because sometimes those conversations are not happening with their parents, with their elder brothers or sisters, or even with their healthcare workers, and they have to find a way to be able to access that information. So happy to chat more and share some of the previous publications that we've done, but we feel this is a very important area that requires for us to move with the speed, because technology is moving faster than either laws or policies, and young people continue to be more innovative on how they engage into these spaces, and we are more concerned around how are their rights protected while they're within this particular digital sphere, because it's very important that their mental status and their health status remains safe and sane for them to live healthier lives.
Thank you so much, Alan. And I think we also have the digital health strategy, right? That is also kind of governing some of the work that we are doing with the Digital Health and Rights Project. I recognize a hand that is close to the entrance or exit, but before that, you wanted to add something, Alelo?
Yeah, some of the other issues that arise that we're going to focus on are also some of the issues that arise from the use of digital health technologies. As we've mentioned, our kids are on apps and where they're getting the information from, but do they know about their issues to do with consent, their own privacy, confidentiality? We also need to address the issue of gender divide and issues of access, maybe for I'd say urban areas, like what the difference is, if it's a gender divide issue within the access space. Those are also some of the issues that we will be really looking at.
Thank you so much. Yes, you can proceed.
Thank you so much. I think the beauty of being a volunteer is I can get through your sessions as well. So my question really is about on social media and the laws around each and every country. So then how do we engage in programs that break on the ambiguity of the law to make sure it's clear what is too much on social media, and how do we get to people directly without bending over certain laws in what we can deliver to an audience? I remember in Zimbabwe, I think 3-4 months earlier this year, someone actually got arrested, but they were in line with some, sexually related issues. So how can we structure in programs that allow us to deliver the information we want to deliver to people in regards to sexual health, as well as not going in violation with the laws, the ambiguity, the clarity, everything required? Thank you.
Fantastic. Thank you so much for that. Over to you, Orlando.
My understanding is that your question is around the ambiguity. The first aspect, as we will be disseminating the research findings from this research, what we will be doing at the national level is to also, as we're disseminating the findings, we'll also be creating awareness so that people know what their individual rights are. The main focus on digital health rights, other than the research bit, will also to empower and encourage young people to be able to know what their rights are. I mentioned on confidentiality, privacy, consent, and other than the other issues on access. Do young people know about this? Maybe some of us are parents here, even at home, while you're talking to your kids about social media, make sure you're teaching them about the basic human rights. We're really trying to make sure that digital rights are considered human rights, and it's part of everyday conversation. So even as we are interacting with young people at different levels, there may be young people at your workplace or even in your home, make sure you're teaching them about the digital rights. I think that's one way to be able, once we are fully sensitized, and I don't think that's 100% possible, but once we're fully sensitized to know what our digital rights are, then we'll be able to know and find ways in which we're able to navigate how to access and how to deal with the ambiguity of that. The other issues will be to the stakeholders to the county, not county, but I'd say that maybe politicians or even the leaders within the countries, do you have laws and policies? I know for my country it's different. From Zim, I'm very sure it's also going to be different. We also need to look at what are the laws saying, what are the policies on sexual health rights and online and what do I call it, and digital technologies. We need to know what those laws are. In Kenya, we currently just enacted the Digital Health Act, and I'm very sure one way or another, some of the clauses within that act are going to be able to regulate. We also have policies within the same space that will be able to regulate some sort of ambiguity. I think that could work.
All right. You want to add something?